Hello and welcome everyone. So in this video I'll try to teach you how to draw a caseating granuloma step by step. So histology of granuloma we'll discuss, and I have already told you that granulomas in tuberculosis can be caseating as well as non-caseating. Caseating granulomas generally they are seen when the immunity is low and there is more caseation and there is more AFV positivity shown with Zn stain, while if the immunity is good then the granulomas they are non-caseating, and also the Zn staining positivity it is very rarely shown in non-caseating granulomas. So if in exams the granuloma comes, then you can draw either caseating or non-caseating granuloma, but better to draw caseating granuloma for tuberculosis. And I'll just show you. It's very easy to draw. You just have to understand the concept and you will draw it very easily. So these are the 5 components of a caseating granuloma. First is epithelioid cells. Epithelioid cells, they are slipper shaped and they have a oval shaped nucleus. They have abundant eosinophilic pale cytoplasm. Then second component is lymphocyte, which is surrounding this granuloma in the form of collar, and lymphocyte we just have to draw a dot, the blue color dot, and cytoplasm is generally not visible, so we just draw it like a blue dot. Then third are Langerhans giant cells. Langerhans giant cells, they are collection of epithelioid cells. Now epithelioid cells also, they are just modification of macrophages, and the Langerhans giant cells, they are fusion of epithelioid cells. So lot of epithelioid cells they fuse together to form this giant cell. You know, giant cell is a collection of many cells, and here the specific point about giant cell is that the nucleus they are arranged in the periphery in the horseshoe shaped pattern. So this is important, that horseshoe shaped pattern the nucleus they are arranged. Then next component is the caseation necrosis, very important. In the center we will draw this, and it is pinkish amorphous granular. So this is the morphology of caseous necrosis. And the last component is fibroblast. So granulomas which are long standing, which are chronic, so generally the fibroblasts they tend to be present in the periphery of the granuloma, and it kind of walls off the lesion, the walls of the granuloma. So these are the 5 important components, and now we just have to draw these components to make a granuloma. So let's start. So this is a in the center we draw caseation necrosis. It has to be pink, granular, amorphous. Then we draw epithelioid cells next to it, and some giant cells in the adjacent to the epithelioid cells. Then we fill it with the cytoplasm. So it has to be pink cytoplasm. After that we draw the nucleus. In the giant cells we draw nucleus in the horseshoe shaped manner. Then we draw nuclei of the epithelioid cells. In the next step we draw the lymphocytes just in the form of small dots with the H pencil. So there is a collar of lymphocytes. You can also draw in between, also you can draw the lymphocytes. And then in the most peripheral part we draw the fibroblasts, and fibroblasts they are spindle shaped and they have pointed ends. So that's how we make the fibroblast. And then we have a elongated nucleus in their center. So this is how we make a granuloma. Then in the center we have caseation necrosis surrounded by the epithelioid cells and giant cells. Then we draw a collar of lymphocytes. In the most periphery we draw the fibroblast. And in the last, what we'll do the labeling. So this caseation necrosis, lymphocytes, giant cells, then fibroblast. We just write all the labeling is very important to end a diagram, and you should label all the components of a granuloma. So these are lymphocytes, then Langerhans giant cells, and what is left? Epithelioid cells. So these are the epithelioid cells. So this is how we make a granuloma. I hope it will help you, and questions are most welcome in the comment section. Thank you very much.